It is January 25th, 2023. That means today marks 3 years since Canada recorded its first case of what we now call COVID-19. In those years, we've seen the virus strain our healthcare system, particularly in hospitals and long-term care facilities. So the question now is, where do we go from here? Dr. Ahmed Arya is a palliative care physician who works in long-term care in hospitals across the GTA. He joins us this morning from Mississauga. Good morning to you.
Good morning, Lindsay.
So this January, Canada marked a sobering milestone. As of January 2023, more than 50,000 Canadians, in fact, 50,303 Canadians have died from COVID. This is according to Johns Hopkins University. When we think back, Doctor, to the very beginning of this pandemic, what surprised us the most about how our system was operating at the time?
Yeah, I think that's a great question, Lindsay. And I can tell you on a personal level, as somebody who was working on the front lines and continues to work on the front lines of hospitals and long-term care facilities where COVID-19 is still having a negative impact. I think there were really two things. Firstly, we didn't really learn our lesson from the original SARS outbreak, which happened in 2003. We didn't have adequate supplies of PPE. We assumed that COVID-19 was spread through droplet transmission, when in fact that wasn't true, and it turns out it spread through airborne transmission. We also, in the early days of the pandemic, had a really myopic focus on hospitals and protecting, ICUs and ventilators, which was important, but we forgot about long-term care homes where, in the early days of the pandemic, a humanitarian tragedy actually unfolded, and it turned out that Canada actually had, the worst consequences and the worst outcomes in long-term care homes with the highest proportion of COVID-19 deaths compared to other OECD countries.
You just mentioned a couple of things that brought me back those first few months, like with the no PPE. Do you remember we were just trying to get our hands on anything? I remember ordering masks, Doctor, and I think they came 7 weeks later. We had no vaccine at the time. We know that we've got a facility that will hopefully facilitate that in the future. Are we doing enough to prepare right now?
Yeah, I think we are doing some things to prepare. And I think the good news about COVID-19, which shows us, what can happen if we come together, is that the science has progressed so much since those early days, Lindsay. As you mentioned, we know that masks, especially proper masks, KN95 or N95 masks, can work very well when implemented at a population level. Once again, we know that COVID-19 is spread through airborne transmission. We have fantastic vaccines and boosters, which protect us from the most negative impacts of the virus, hospitalization and death. And we also have great antiviral treatments right now, which can help high-risk individuals who are infected. I think really where we have failed is really on protecting our public healthcare system and failing to realize that we cannot have a public healthcare system which is so under-resourced and understaffed in regular times, even before the pandemic, and expect it to do well through a crisis such as this. And we've also failed on the messaging in the pandemic, and I think that's something that governments should take responsibilities for.
How so? In the communication side, how so?
Yeah, so I think the communications have really changed through 2022 at the start of the Omicron wave. Many people started to receive the message that COVID-19 is over, the pandemic is over. And I wanted to emphasize that that's not true. You might be shocked to hear that we actually had the most deaths from COVID-19 in 2022 when we already had vaccines. And I'm very worried about that for 2023. And once again, I wanted to emphasize it's not because we don't have the tools to actually keep society open and keep us all safe at the same time. The problem is we're not implementing those tools. Our governments actually aren't providing us, once again, the messaging or the resources so that we can, do that. So some, easy things that I think we could do is, once again, encouraging people to mask in indoor public settings and actually providing people with proper masks, upgrading essential infrastructure to improve ventilation and air quality, places like schools, workplaces, healthcare settings, providing people with 10 or 14 paid sick days so you don't have to go to work when you're sick. Those are some, I think, simple things that we can do to continue to protect us in 2023. Very important.
Very important. And we're going to end it there. Dr. Arya, thank you for your time and thank you for everything you do.
Thank you so much, Lindsay.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.